Even though cancer rates are rapidly rising and it's almost down to 1 in 2 people will deal with cancer, it's not something you need to live in fear of, and it is something that you can improve your chances if and when you meet cancer by taking care of certain things within your own health. And there's some really good cheap testing out there that you can do that will tell you how your body is currently handling cancer or how you can expect it to handle it if you run into it. Now, I think before I go into those tests, I recommend everyone gets this book, The Metabolic Approach to Cancer by Dr. Nasha Winters. I've read a lot of different books on cancer, and this is easily my top 2 or 3 favorite ones. She has so much great information in her about how you can improve your health, but also talks about a lot of the testing I'm going to share today. So let's dive in. The first test that you want to do, and you can get this through any medical provider, is a complete blood count, or a CBC. Now, all doctors will run this for you. They do it at all your annual checkups and everything like that. But there's a couple of pieces from this CBC that you want to look at. And just be aware, most of your conventional doctors won't look at these things in the way I'm going to share right now, but this is for you to know what to go and look for. So the first thing we want to look at is white blood cell count. We want that to be between about 5 to 7. Too low means your immune function isn't going to be very strong. And in fact, when you're doing chemo or conventional cancer therapy, they look at this white blood cell count that if it's too low, you're not going to be able to handle the treatment, and they want to get it up, usually artificially, to try and correct that. But too high can also mean that your body is starting to navigate a cancer problem. Now, keep in mind as well, with all of these tests, they can all be up or down for their own reasons, so we're looking at the entire picture. So don't panic if 1 or 2 of these things are off. The next thing we look at is the neutrophils and lymphocytes, which will be on that complete blood cell count. We want the ratio of neutrophils to lymphocytes to be about 2 to 1, no more than that, and no less than 1 to 1. Lymphocytes being higher than neutrophils is a really good chance that you've got some blood cancer going on. And if the neutrophils are too high, then that can be a whole bunch of other health issues as well. Then we look at platelets. We want those to be between 175 to 250. Too low or too high can mean you're going to have clotting issues and immune function issues. And if it's starting to elevate, that can be a really early cancer alarm system for you as well. So just watch that. And again, keep in mind, conventionally, the doctors will look at these things, but you often won't hear them talk about neutrophil to lymphocyte ratio or even what the platelets mean. Then we go to the comprehensive metabolic panel. There's a few things we want to look at here. Creatinine above 1 means that your kidneys are struggling to filter. Again, doesn't mean you have cancer, but it means they're struggling with something. Liver enzymes are really important to test. When they're starting to get up above about 20 to 25, then your liver isn't processing properly and you're not detoxifying correctly. Then we also want to look at alkaline phosphatase. That will often increase if there's bone metastases or even some bone loss. Now, all of these can go up if the liver's struggling with other things. Maybe you've got a lot of heavy metal toxicity and mold and parasites. Maybe you're taking some medications that are beating up your liver. So again, you can't look at these on their own and say, oh my gosh, I have cancer, or I'm going to do badly with cancer because of these results. It's putting the whole picture together. Now, after the CBC and the comprehensive metabolic panel, there's 3 other tests that you really need to run, and these 3 together are going to give you a lot of information. The first one is LDH, or lactase dehydrogenase. This might even be the most important test you can run for any chronic health issue. All patients I work with autoimmune problems or any kind of chronic health problem, we always test the LDH. Because the reason is, if it's increased, it shows that our mitochondria aren't working properly. And if your mitochondria aren't working properly, then your body is going to struggle to detoxify and recover and heal from whatever is going on. This is an especially good marker for certain cancers like lymphomas, leukemias, multiple myeloma, and melanoma. And in fact, when I had a melanoma on my back cut out a couple of years ago, my LDH levels were starting to get high, and that's when I knew I had a problem. I also had an increase in ferritin, and melanomas like to pull ferritin and iron. So just some things to note. Now, we also don't want LDH to be too low, because that signifies malnutrition and muscle breakdown. Ideally, we want it definitely under 200, but ideally under about 175. Then we have the ESR, the sedimentation rate. We want that below 10. Higher means we're inflamed, probably autoimmune issues. It will go up when you're getting metastatic spread. So again, just because it's high, it doesn't mean you have cancer. I've seen this very high in severe autoimmune cases. But again, we put the whole package together. Then we have the high sensitive C-reactive protein, another really good inflammation marker. Ideally, you want this to definitely be below 1, ideally below 0.7, and there's a few labs that the cutoff is 0.3 instead of 1 because they measure it in a different metric. In those cases, you want it to be below 0.1. Keep in mind, I've seen people be normal on that test, and then I run their fatty acid panel and we run an AA-EPA ratio, which is an even more sensitive inflammation marker, and that shows a lot of inflammation. Now, in terms of cancer though, I would recommend running that one too, the AA-EPA, but that's going to go up with any inflammation. But if your ESR, your high sensitive C-reactive protein, and your LDH are all normal, but then that AA-EPA ratio is up, I'm not worried about cancer. I just know that's an early sign of some kind of inflammation. So again, you've got to look at those three especially together, because one could be up because of autoimmunity, medications you're on, stress, alcohol. But when all three are up, now we know we're starting to get a problem. So if only one is up, that's your early warning sign to say, hey, I need to metabolically improve my health. Because we know that if you've got an increase of glucose or insulin sensitivity or obesity, you're not metabolically as healthy as you can be, which means if or when you run into cancer, you're going to struggle more. So as soon as any of these markers are up, you shouldn't panic. And that goes for the complete blood count and metabolic panel ones too. Don't panic, but the more that are up, the more you want to take that as a warning sign to start working on your health. Just start eating cleaner. Let's get rid of processed foods and sugars. I really like people going on more of a carnivore style diet. If you're going to eat plant-based, make sure you're not eating plants that are high in lectins and oxalates that are going to inflame you. If more of these markers are going up, then I recommend that, okay, if you're really worried cancer might be starting to happen, do a ketogenic diet, but a clean ketogenic diet for a good 3 to 6 months. I don't think people should stay in it long term, but when you combine ketogenic diet and a lot of intermittent fasting and multiple day water fasts, then your body is really going to get metabolically switched back on, and you'll probably navigate cancer a lot better. You also need to go and remove any underlying biotoxins. There's more than enough evidence stacking up the parasites, heavy metals, mold, all of these things can cause cancer as well. So we've got to get those out even if you're very healthy. And when it comes to deciding what treatment to do, that's between you and your family and your doctor. But I just want to share some statistics here, because all that advice on cleaning up your lifestyle and diet and exercise and stress and dealing with underlying biotoxins, everyone should do that anyway. And if you have cancer, you definitely should do it, whether you're doing integrative treatment, only holistic, or only conventional. But here's some stats based on a success rate being not the elimination of the disease of cancer, but debulking or shrinking of the tumor. Over all cancers put together, surgery has about a 50% success rate of shrinking or debulking. Radiation has about a 12% success rate. Chemotherapy has about a 3% success rate. Just something to keep in mind when you're having treatments thrown at you or forced on you in a fear-based mindset of you must do this and you must do this now. If you go and get these blood tests and metabolically you look reasonably healthy, and you know you're reasonably healthy, you don't carry a lot of obesity, especially around the stomach, you exercise, your stress levels are good, you eat pretty clean already, then you probably have more time than you would think to go and start changing your lifestyle. And if you really want to get metabolically healthier, especially if you're dealing with cancer, then please go and buy this book, The Metabolic Approach to Cancer. She has so many amazing health tips and metabolic tips in there, as well as talking about all of this testing. And if you still have questions about any of this, just leave a comment below and I'll answer it as best I can, considering I can't give medical advice over the internet, but at least can try and point you in the right direction of resources or doctors to go and work with. Because we don't need to live in fear of cancer. Yes, it's a horrible illness that's causing more and more damage, but that's happening because we live in a toxic soup and we're not looking after ourselves. If we did that, we could wipe out almost all cancer if we turned all of that around.